All right, welcome back, everybody. Thank you for returning from lunch. And having done a couple of these, each of us on stage, we know that we have quite the task ahead of us as the first panel after lunch. Yes, that is true. So we are going to try and entertain and delight, and we just ask that you hang with us and engage us right back. We started the day talking about uncertainty. Carla, thank you for that. These are uncertain times. And we also started today with an inspiration, and I thank you to you and your story. And I think a lot of what really got me motivated hearing the first panels of the day was just this urgent need for action. My mentor early on in my career taught me that policy is defined as movement in a direction for a reason. And if you think about where we are in certain aspects of mental health in this country, we're not going in the right direction. So therefore, we need policy to take action to move us in a different direction. And that's what we're going to talk about today. I am joined here on the stage with three amazing colleagues, one of whom you already know, or if you don't know by now, you're not paying attention enough. So maybe she didn't even need to introduce herself. But I will ask my colleagues here just to briefly name, rank, serial number, and then we'll get started.
All right. Angela Kimball, Chief Advocacy Officer with Inseparable. We're a national nonprofit mental health advocacy organization.
And then Stephen Schultz, I'm the Director of State Government Affairs for Sage Therapeutics. Sage Therapeutics is, alongside our alliance partner, the manufacturer of the only FDA-approved oral medication to treat postpartum depression.
Joy. Burkhard.
For the people at home.
Nice to see you all again. And I'm so excited about this panel, truly. And Ben, you didn't introduce yourself yet. And,
Yes.
Ben is an icon in the space, and I do think that's true and well known in the policy world. So thanks, Ben, for being on our board and Inseparable's board.
Thank you, Joy. So we wanted to start, those of you like us who may live on the deep end of policy, you probably watched with bated breath what occurred over this past weekend. Is the government going to shut down? Is it going to stay open? Who's voting for what? Where are the factions within each party? There was a lot that transpired both politically and in policy over this weekend. So I couldn't help but think of a better person to ask this first question to than the woman to my right, your left, Angela Kimball, who knows all things. She doesn't have a magic crystal ball just yet. But Angela, when I was watching the news and I was trying to figure out what in the world does this mean for our policy agenda, I figured you probably had some ideas about what is happening right now within public policy as it relates to mental health. And what are these trends that we're seeing emerge right now between kind of the federal government and the states? And how do we best kind of show up and make an impact in this, dare I say, chaos?
It's such a simple question.
Yeah. You have 30 seconds.
All right. So I'll just say well, first of all, Inseparable is focusing on state work precisely because of the level of chaos at the federal level. So when we look at the continuing resolution that was just passed, if you don't pass a continuing resolution, then there's the opportunity to shut down the government and potential to even further decimate federal agencies. So passing the continuing resolution provides some level of safety. But at the same time, this particular CR included some not insubstantial cuts in it. And I'm thinking HRSA, for example, over $890 million, $72 million in SAMHSA. So really what that does is creates a new baseline for budgets moving forward. And then, as if that weren't bad enough, now that the CR is done and sealed, now it's time for Congress to move forward on a budget reconciliation. They would like to do that by Memorial Day. Others say, not going to happen until the August recess. But the reality is, if they wait past September 30th, then they have to start the process all over again because technically they're in fiscal year 26. So I'm saying a jumble of words, but budget reconciliation is an opportunity for Congress to actually revisit some of the biggest programs we have, like Medicare and Medicaid, and make really substantial cuts to it. And this is where you hear people talking about the target of $880 billion cut in the Energy and Commerce Committee in the House of Representatives. There's no way you get to $880 billion in savings without massive cuts to Medicaid. So while we're looking at that, the challenges are just enormous at the federal level in terms of what we're going to see moving forward. And so I think Medicaid is something previous panels have brought up repeatedly, massive disruption to all of our systems. And I have to say, one of the things that we're starting to hear, like from the Freedom Caucus, is this notion that, well, we're spending too much on Medicaid. It's grown too much. And really what we need to do is get rid of all those able-bodied adults who don't really deserve to be on Medicaid. Let's just take care of the kids, the pregnant moms, etc., and then we're good and we can carve all this money away. The challenge is really, as you all know, that if you lose that insurance pool, that risk pool of all those lives, you don't allow healthcare systems to actually sustain and deliver. So it's not looking particularly bright. So I'll pause there and let
it's
you
good.
go
And
on.
I think at this moment, we should be very honest with ourselves about what we're facing. And I mean, how many times do we hear from Stage already today? We have a workforce crisis. We can't figure out enough how to get enough clinicians in the right places. Well, I can tell you how not to get them in the right places is to pay them less. And that's what's going to happen when we have some of these cuts. So Stephen, states are the laboratory for a lot of innovation. And I think over the last several years, we've seen some really unique examples of where states have come forward with ideas on modifying, changing how we approach mental health, especially through their waivers. What are some of the trends that you're seeing out there when it comes to mental health in the states?
First of all, I want to appreciate Policy Center for Maternal Mental Health and all the work that Joy and your team do, and appreciate allowing Sage and myself to take part and be a part of it. I will say, kind of starting off this discussion around kind of what the landscape of maternal mental health looks like in the States, is that so many of the people in this room, is this working? Okay. So many of the people in this room and listening at home have done a lot of this work to get us to this point, and are doing amazing work this session. And so a lot of what's I'll say, as well as a lot of the features, like an amazing blog that the Policy Center just put out recently that did a great landscape of what's going on across the country, is out there because of the amazing advocates in this room today. And I just appreciate the opportunity to work with a number of you, and it's exciting to be here today and see so many of these faces, or look at the attendee list and see who's listening remotely. But I think from that general landscape I'll start with kind of a broad perspective of a number of states doing the great messaging of a momnibus. I think you saw that last year in an enacted version in Kentucky. There's a few states out there working on it: Arkansas, New Hampshire, Oregon, on kind of broader reforms to maternal health. Sometimes in those momnibus bills, they often won't do a lot of call outs or carve outs or really dig into maternal mental health. And so sometimes you'll see that from an advocacy standpoint is that's an opportunity to kind of say, hey, if this is going to be a true momnibus bill and we're going to really try to improve outcomes in the maternal health space, you can't leave maternal mental health out of those types of packages. I think you're also seeing a lot of reforms in the screening and education space in a variety of different states. I think you're seeing a number of states that are actually trying to say, okay, let's make sure the screening's taking place and have good discussions about that, but also ensure that after that screening is taking place, like so many people have said on this stage today, that after that screening is taking place, is that there's a linkage of that screening to actual treatment options, no matter what that treatment option is. And then also within that, I think you're seeing discourse in this space around medication access, which is something that we're watching very closely. And it's going to be really the first time that's brought up in the discourse, is because now you have something that is specifically indicated for the treatment of a maternal mental health condition and disorder. And so you're seeing that for the first time, as far as you've seen states be real incubators and thought leaders as far as utilization management and medication access. You've seen kind of step therapy protocol bills or prior authorization bills in the cancer and oncology space, in the broader serious mental illness space, or in the just broader medication space. But this is the first session with states like Arizona, Alabama, Mississippi, Louisiana last year that have really kind of taken it on to say, what can we do around access to a space that is brand new and there is innovation taking place in it.
I love what you're saying. You know, technically, to be able to get things done at both the state and national level, you need both parties to agree in some ways to do something together. So in concept, bipartisanship is still a word. I don't know in practice if it's something that we see very often, except outside the states. Joy, not to put you on the spot, but this is a really tough one to answer. But how have you all, the Policy Center, really pursued strategies around bipartisanship? And what are some of the opportunities that you've seen out there that kind of bring both sides together?
Really important question, especially right now. We actually had our first health affairs consulting firm, Center Road Solutions. Emily's representing Center Roads in the room now. Give us great advice, and also our sister nonprofits great advice early on, and that is we always should introduce a bill, or a bill should always be introduced with both parties, particularly at the federal level or in swing states. That way you don't, number one, make your issue about one party, which none of us believe maternal mental health is Republican or Democrat or vice versa. And number two, you don't want it to be unwound, whatever it is you built. And so we really took that to heart ourselves, and our partners at Maternal Mental Health Leadership Alliance have also been following that strategy. And so I wanted to start with that. And then, you know, are there opportunities to continue to work across the aisle in this space? You know, because of the overturn of Roe, we actually are hearing, when we do speak with legislators, both in the states and a federal level, that they know, Republicans know, that they need to do more to support women and families. You can't, these are my words, we can't force people to have babies and then not support them. There's recognition. I think it's such a difficult time right now. If we're talking efficiency and cuts, then, you know, what can that look like? So I think that's a real challenge for us. I don't think we're going to see nearly enough progress in that space. But I'll give you one other concept that I think could be interesting, and something that at a federal level in particular might stick and be of interest. That is, we've heard about telepsychiatry consultation programs, and I see Jamie and Adrian in the room from Maternal Mental Health Leadership Alliance. And Jamie was really the champion behind bringing postpartum depression out of the Shadows Act, which was, 6 years ago or something like that, Jamie, longer. And that provided grants to states to stand up these telepsychiatry consult programs. We've heard about them on the panels previously. So that's a concern, that those funds could be at risk with what's happening now. We just heard about the HRSA funding cuts and the continuing resolution. We've also heard from states that when the grants run out, they're not necessarily able to keep them alive. And we know that they're critical. And then we're also worried about the states who might never have them for a variety of reasons, and particularly southern states. California is actually one of these states that, because it would cost the state so much money, it has not been able to stand up a statewide program. So all that to say, I keep thinking, if we're talking about efficiency, you know, could there be a federal mechanism that provides funding to hubs to bring this to scale across the United States? To me, that's efficient in healthcare. Whether others in Congress or the administration would agree is another story, but something that I'm hanging on to that both Republicans and Dems, I think, could be interested in.
Yeah, it's a really good point. And I think those of us that have seen the surveys, I know Inseparable's done some of this in the past, when you look at these issues, almost every single person, no matter their political affiliation, says it's a priority. And then the general public, no matter their political affiliation, says it's a priority. So like everybody wants to do something here. So let's shift from policy to actually implementation for a second, because there is a pretty significant delta at times between what goes into the bill and then what actually happens on the ground. And so, Stephen, I want to come back to you for a second. And when we begin to think about some of the biggest barriers that states face implementing policies as it relates to maternal mental health, sometimes it's daunting. I'll just give you one example. I remember working in the state years ago. They had a wonderful piece of legislation that was passed, and yet they had no one at the state level to actually help enforce it. So it was great in principle, but it never got done because there wasn't anybody funded at the state level to help make it happen. So like when it comes to the implementations, what are you seeing as some of the barriers in the states keeping us from kind of getting to where we need to be?
I think that's a great example of how troublesome some of these situations can be. I think your example is one that I've seen in a lot of states, is that sometimes when you're writing the bill in a certain state, you do need that directive to start rulemaking. And if it's not in there, then the department may be in a tough spot as far as working with those stakeholders to actually enforce the bill. Or, like you said, there may not have been an appropriation tied with the bill that allowed the department to do that. But I think you would hope that the department during the legislative process would engage with those stakeholders to articulate that. But sometimes that's not, those things don't happen in the process, or they're tied by maybe the governor's office or the administration from being able to weigh in on legislation. But I think it's part of being those good stakeholders in that process. If you're writing a bill that's relevant to those, and you're going to be the ones to enforce it. And that's also important as far as having stakeholders that have gone through this process before to ensure that outreach is done and kind of hold those administrative offices to account to say, hey, we really need you as a part of this process, and to ensure that when these laws aren't getting implemented correctly, to ensure that those complaints are filed into the administrative offices. A lot of these administrators will not comment on it, or will not take any action to affect that implementation if they're not hearing from those patients getting affected, those providers that are having issues. And so going through that process to ensure that it is implemented correctly. I think it's also just the funding aspect of it, and ensuring that that these departments are properly funded so that they can go ahead and take ownership and implement it. But I know it's something that's not only just important in our space. I know the amazing folks at the Kennedy Forum were here. That's been something that every time I'm interacting with parity laws or seeing parity laws enforcement, any type of insurance restrictions or reform that will help patients. That's a big aspect of it. And I think so many times I've had to recommend to patients to go through that complaint process, do everything, providers go through that complaint process, ensure that all those boxes are checked so that they can't deny that, hey, we're not hearing anything. This is being enforced well, or it's on the books. We're not hearing anything.
And it's so much pressure on a patient. I'm just going to say it. And the provider. We already heard all that, but it's too much. It's too much.
You're putting the onus on them to make sure that a law is
doing the right
being,
thing.
And here we are. I mean, we're experts in policy, and I think most of us would have a hard time even completing some of those checklists ourselves.
Yeah.
You know, it's quite daunting. And it's cruelly ironic that it's most daunting when you're in the middle of a crisis, too. So, well, there's that. So, Angela, building off of what Stephen was saying, stakeholder engagement and building a coalition of the willing that are kind of taking the collective steps forward to take action in a state feels like one of the superpowers that you have. You know, so when you look at states, and especially a lot of the work that Inseparable's done, how have you been able to bring together the right people at the right time to push the right kind of policy?
That's a great question. I'm not sure I actually have an answer. I would say
You can say
that
magic too.
just magic. Just wave your magic wand. I would say some of our best luck has happened when we go into a state just with open ears and sort of an open heart to find who are the people on the ground who are doing the work, who are connecting with people's real lives and speaking from experience, the experience of patients themselves, and finding those who are really willing to step up and actually do something. So you find unusual partners sometimes. There have been times when it's law enforcement, frankly, who has come to the table to say, do you know how many times we've had to transport and sit in emergency departments? That's not our job. We think the mental health system ought to be taking good care of people. So it's really about being open to who are unusual partners that could help support this, looking at those downstream costs, who's impacted, and figuring out what are the pain points in a state and who are the partners that can naturally speak to those pain points. So currently, a lot of states are actually having incredible demands on their child welfare systems. So if you think about that and then think about the role of maternal mental health and how that's supportive, that's a way to keep moms and babies healthy and happy and help prevent those downstream costs. That's a way to really help people think upstream and really get ahead of the curve.
I love that. And having the authenticity of the community that's bringing forward their ideas, their language. I mean, that's how you really get meaningful change that's in service to the people we're trying to help, right? So Joy, I want to turn to you on this one because some of this in the room been doing this a couple of years. And I think back to the beginning, at least my career, where no one even wanted to talk about mental health. You didn't want to say the words. And I think maternal mental health was even more stigmatized and less talked about. But we've made progress. And how do we keep that dialogue not just sustaining, but growing? It's kind of like the chord's been struck. How do we turn it up? How do we continue to draw attention to this important issue?
And first, I'm thinking about the journalists in the room. Thank you for helping to raise the profile of maternal mental health. It's taken champions like you writing articles. So that comes to mind. And I also think it's really important to just acknowledge the progress that's been made. A lot of it is in part because of the Perigee Fund. And we'll talk about the Perigee Fund in just a bit for investing in a few of our organizations, the Maternal Mental Health Leadership Alliance and the Policy Center, the profile that was raised because of the maternal mental health hotline and the news coverage of that hotline, I think really propelled, there was already great progress being made, but that is an example of why it got propelled. And of course, the approval of the first ever oral pill for maternal mental health, postpartum depression, CBS Sunday Morning News and others that covered the issue finally. So it's been a convergence of lots of great things, but those to me in particular. What I'll say is that I do think it's an important time, as Angela mentioned, to pivot back into the states. And so if we can start to think about how do we raise the profile in our states, we were proud to be releasing the maternal mental health report cards that give each state a grade on their investment and profile. And that's been helpful in raising state profiles. I think those kinds of tools, including the report that Caitlin mentioned earlier on dark zones and risk, like was it North Carolina? Like the risk has jumped through the roof. We need to be having those kinds of conversations, I would say, at the state level. The last thing I'll say about state level too is this is really where the rubber meets the road in health policy, right? So at the federal level, unless there's an ACA, Affordable Care Act, Obamacare effort, really, it's just about grants going to states to pilot things, and then we don't see anything stick. From my perspective, things dry up, and so I actually prefer to work in the states because that's where you really can leverage change, and it's always about, from an implementation standpoint, to me, billing codes, right? How do we bill? We need Medicaid, and then how do we bill? Are they the right codes? And until we have that, we're just talking.
So, Stephen, I want you to pick up on what Joy is saying here, because I would imagine that you have a vested interest in people paying attention to this issue too. How do we continue to amplify and even more so kind of doubling down on what Joy is saying? There's this thing that happens in public consumption of information where sometimes we become desensitized to either how bad it is, and we just convince ourselves it's not that bad. And the example I used to use all the time was drug overdose deaths. You know, they're growing for 20 years until they're like an all-time high, and people are like, oh, it's going to get better. It's like we stop paying attention to how bad the problem was. When you look at some of the maternal health outcomes, as has been shown repeatedly today, not a lot. I mean, there's some good news here, but there's still some trouble we got. So how do you keep this on the front burner, and from your strategy perspective, how do you make sure that this is kind of front and center for folks?
No, I appreciate everything you just said, Joy. I think those types of reports are so crucial. I know how many times I've seen stakeholder use your guys' policy report cards. Legislators love report cards. They're able to say, hey, we were a D, now we're a C. I think about Maternal Mental Health Leadership Alliance, your state report cards, or March of Dimes, the maternity deserts. Those are amazing resources to walk into these legislators' offices and be able to educate them on these issues. I think, like you said, there may be some aspects of saying, hey, there's a lot of uncertainty. There's a lot of unpredictability right now. Maybe we should take the foot off the gas, but I think it's a perfect time to put the foot on the gas and really ensure that there are going to be priorities for these policymakers, especially in the states. And there's no reason why this shouldn't be the top priority or a top priority. There's going to be something that's a top priority. There's going to be bills that pass each year. This should be amongst the things that these legislators and policymakers are working on. And I think getting entrenched and getting really involved with these legislators, they're at things like the National Governors Association, Women in Government, National Foundation of Women Legislators. They're at these types of groups and working in a bipartisan fashion and determining what should be those top priorities. And so these fellows that you have, these amazing advocates that are in this room and listening in, getting entrenched, finding these legislators that are going to be in the next wave and making sure that maternal mental health is a top priority for them. It doesn't necessarily have to be an OBGYN or someone that has that working background, but we've seen those types of providers and those types of folks with those backgrounds take this issue and really be champions. So making sure that when you're determining who you're voting for, ensuring that this is a top priority.
I'll just build on that because I think, Stephen, you said something really important, and it leads me to think you have to be opportunistic. So I'm thinking like we're working in the state of Montana and discovered a legislator who is adamantly interested in passing legislation to actually ensure greater patient protections in commercial insurance. Well, would not have thought, this Republican senator from the state of Montana would be so gung-ho and into the details of what it really takes to make sure that state statute is aligned in a way that's going to really help advance improved access to healthcare for people with chronic conditions. So that's really encouraging. And to me, I'm really hopeful because I do believe that out there in the states, there are so many people who want to be champions. They want to do the right thing for constituents. And our job collectively is to help show them that pathway forward.
Sorry, well said, Angela. Well, in our last minute here, my final question to you is around what should we be looking at the next 5 years as it relates to this topic? And I feel so, I say this a lot, but I mean, we are the leaders in this moment. And when we see things not working, it's up to us to do something about it, not to wait somebody else to do something about it, for us to take on charge. And so in this moment, as chaotic as it and uncertain as it's been, where should we be focused? Knowing that now is not a time for timidity, that policy is the biggest vehicle for advancing major reform. Over the next 5 years, where should we be looking? And you can use any of the P's that we've talked about throughout today, and I'll let any of you start to close us out.
Okay, they're looking my way.
Go, Angela.
So actually, I just kind of harken back to some words that were told to me way back in the day when I first started out, and it's follow the money, leverage the law, empower the people. And when I think of those three, phrases, those really drive me forward, and they allow you to really dig in and think about how can you really create change in this world, regardless of what the circumstances are. And I truly believe there's always opportunity. Every situation creates that. So we just have to keep our eyes open and look for, where is that money going? What does the law say about how funding is used? And the power of your story this morning was absolutely sensational. That is what moves hearts and minds. And the data, frankly, helps people align around what they already believe. It is the power story that actually changes where people want to go. And so that's what really drives me these days.
I think I'll be quick and say, I think in addition to what I've previously said, what I haven't said is, I think for looking at the next 5 years is maybe look at where the innovations may come that will help with maternal mental health. I think we're right now, speaking from kind of a stage perspective, looking at, okay, we now have a therapeutic option available and having to be reactive, but then maybe looking at other innovations that are coming or other ways to really improve maternal mental health outcomes and being proactive about what policies should be in place to assist where those innovations are coming in the next 5 years. So being a little bit more proactive as opposed to reactive.
That's a good segue, because our next panel after break is about new innovative solutions. But I did also want to share just a couple of things. States, right now, we've seen the most states ever, especially this early in the state legislative session, introduce laws that are specific to maternal mental health, not just touch on them briefly, not say the word, but specifically addressing maternal mental health. That latest blog post report is on our website, 20 states, so the most ever. So we should celebrate that. We also are now moving up ahead of that work and giving feedback to legislators early, instead of waiting until they pass. So we're really trying to influence evidence-based policy and get them aligned with our model legislation that's on the state page. So I'm hopeful about that. The last thing I'll say is that the Policy Center has launched a campaign, soft launched, officially launching here at the forum, what we are calling the 15 by 30 campaign. So by 2030, that's 5 years out, 15 goals that together as a field we can all work to move the needle, and there's 15 measures around them. We're going to be talking a little bit about that tomorrow afternoon, a group of folks that will hang around, and we appreciate the American Psychological Association to be working in partnership with us on that plan.
Oh, that's great, Joy. Well, let's give them a round of applause. Thank you all.